Ever wondered how doctors can predict the health of your unborn baby? Welcome to the fascinating world of prenatal testing, a realm where science and anticipation meet. Prenatal testing, in simple terms, is a collection of procedures performed during pregnancy to determine the health status of an unborn child. This process is of paramount importance as it not only provides a glimpse into the baby's health, but also prepares the expecting parents for any potential health concerns. Prenatal testing involves a variety of tests, each designed to provide specific insights. From blood tests and ultrasound scans to more advanced procedures like amniocentesis and chorionic villus sampling, each test plays a crucial role. These procedures, while sounding complex, are all geared towards a singular goal, ensuring the health and well-being of your baby. So, are you ready to unravel the mysteries of prenatal testing? Let's forge ahead. Why should expecting parents consider prenatal testing? This is a question we often come across. So let's dive into the importance of prenatal testing. Prenatal testing is not just a medical procedure, but rather, it's a window that provides a glimpse into the health of your unborn child. It's like having an early roadmap to your baby's health, allowing you to navigate any potential challenges ahead. One of the primary benefits of prenatal testing lies in the early detection of potential health problems. These tests can identify conditions that could affect your baby's growth and development. These conditions might include chromosomal abnormalities like Down syndrome or congenital heart defects. This early detection can be a game changer, enabling healthcare professionals to intervene at the earliest possible stage and providing the best outcome for your baby. Moving on, prenatal testing also helps in preparing for special care needs. If a test indicates a possible health condition, you and your healthcare team can plan ahead. You can arrange for special care at birth, or even consider treatment before the baby is born. This preparation can make a significant difference to the health and well-being of both mother and child. Finally, let's not forget the reassurance prenatal testing can provide. Pregnancy can be an exciting yet nerve-wracking time. Having information about your baby's health can alleviate some of the anxiety, providing peace of mind. You can enjoy the journey of pregnancy, knowing you've done everything you can to ensure the health of your baby. It's important to remember that prenatal testing is not mandatory. It's a personal decision that should be made after discussions with your healthcare provider, considering your health history, age, and personal preference. In conclusion, prenatal testing is not just about finding problems, but about ensuring the best possible health for your baby. It's about preparation, it's about reassurance, and most significantly, it's about giving your baby the best possible start in life. Prenatal testing, an essential tool in the arsenal of expecting parents. Did you know there are several types of prenatal tests? Each one is designed to provide crucial insights into the health and development of the baby. Let's delve into the fascinating world of prenatal testing. First off, we have blood tests. These are usually the first tests conducted during pregnancy and are typically performed during the initial prenatal visit. They can reveal a wealth of information such as blood type, Rh factor, and immunity to certain diseases. The most common blood tests include the complete blood count, or CBC, which checks for anemia, the hepatitis B test, to ensure the mother is not a carrier of the virus, and the rubella test, which confirms immunity to German measles. Then we have ultrasounds. This non-invasive test uses sound waves to create images of the baby inside the womb, allowing healthcare providers to assess the baby's growth, position, and anatomy. The first ultrasound is usually done around the 8th to 14th week of pregnancy to confirm the due date, while the detailed anatomy scan, also known as the 20-week ultrasound, checks for any anatomical abnormalities. Amniocentesis is another type of prenatal test. This is a more invasive procedure, typically performed between the 15th and 20th weeks of pregnancy. It involves inserting a thin needle into the amniotic sac to extract a small amount of amniotic fluid. This fluid contains fetal cells that can be tested for genetic disorders, such as Down syndrome and other chromosomal abnormalities. Next on the list is chorionic villus sampling, or CVS. This diagnostic test is usually performed between the 10th and 13th weeks of pregnancy and involves taking a small sample of cells from the placenta. These cells can provide information about the baby's genetic makeup and can detect conditions like Down syndrome, cystic fibrosis, and sickle cell disease. Last, but certainly not least, we have non-invasive prenatal testing, or NIPT. This is a simple blood test typically done after the 10th week of pregnancy. It analyzes small fragments of DNA circulating in the mother's blood, which are actually shed from the placenta. This test can detect common chromosomal conditions like Down syndrome, trisomy 18, and trisomy 13 with a high degree of accuracy. Each of these tests serves a unique purpose, providing valuable insights into the health and development of the baby. They allow healthcare providers to detect any potential issues early on, enabling them to make informed decisions about medical treatments or interventions if needed. It's important to remember, though, that every pregnancy is different, and the need for these tests can vary from one expecting mother to another. From blood tests to ultrasounds, prenatal testing covers a wide spectrum. It's a testament to the wonders of modern medicine and its ability to ensure the health and well-being of both mother and baby during this extraordinary journey of pregnancy. What should you expect during a prenatal test? Well, let's dive right into it. The procedures for prenatal tests can vary greatly depending on the type of test being performed. First, we have the routine ultrasound, a standard procedure in most pregnancies. This non-invasive test uses sound waves to create images of the baby in the womb. It's a simple procedure, usually taking around 20 to 30 minutes. The most you'll feel is a bit of pressure from the ultrasound wand. Next, we have the blood tests, such as the quad screen or the cell-free DNA test. These involve a standard blood draw from the mother and typically take just a few minutes. There may be a short moment of discomfort when the needle is inserted, but it's over quickly. Then there are the more detailed tests, like the amniocentesis or chorionic villus sampling. These tests involve collecting samples from the womb, either through the abdomen or the cervix. They can take between 20 minutes to an hour to perform and may cause some discomfort. But don't worry, your healthcare provider will guide you through it. Now, when can you expect results? Most blood tests can provide results within a week or two. For ultrasounds, you may get immediate feedback during the procedure. But for amniocentesis or chorionic villus sampling, you may have to wait up to 3 weeks for results. It's important to note that while most prenatal tests are safe, some do carry small risks. For instance, amniocentesis and chorionic villus sampling, although rare, can lead to complications like infection or miscarriage. However, your healthcare provider will always discuss these risks with you before proceeding. Remember, knowledge is power. Understanding the procedures can help you feel more prepared and less anxious. It's your journey, and knowing what to expect can help you navigate it with confidence. Understanding the process can help to alleviate any anxiety about prenatal testing. Let's recap the essential insights about prenatal testing. Prenatal testing serves as a critical tool in the journey of parenthood, providing a sneak peek into the health of your unborn child. It's not just about knowing, it's about preparing. Prenatal testing empowers you with knowledge, enabling you to take the necessary steps to ensure the best possible health outcomes for your child. There's a broad spectrum of prenatal tests available, each with its unique purpose. Screening tests like blood tests and ultrasounds provide early indicators of potential health concerns. These are non-invasive and pose minimal risk. However, they can only estimate the chances of certain conditions. Diagnostic tests, on the other hand, provide a more definitive answer. These may include procedures like amniocentesis and chorionic villus sampling. While they deliver more precise results, they carry a slightly higher risk. It's crucial to understand these differences to make an informed decision about what tests are right for you. Remember, every pregnancy is unique, and so is every prenatal testing journey. The types of tests recommended for you will depend on various factors, such as age, family history, and overall health. It's not a one-size-fits-all situation. While the procedures might seem daunting, rest assured that healthcare providers are equipped with the knowledge and expertise to guide you through them. Their goal is to ensure your comfort and safety at all times, while providing you with the most accurate information about your baby's health. It's important to have open conversations with your healthcare provider about prenatal testing. Ask questions, express your concerns, and discuss your options. They are there to support you, providing you with the information you need to make the best decisions for you and your baby. So as we wrap up, remember that prenatal testing is not just about detection. It's about action. It's about being proactive in your journey of parenthood, equipped with knowledge and prepared for whatever lies ahead. Prenatal testing, a window into the health of your unborn child.